The South African Medical Association has raised concerns about the charging and prosecution of medical doctors. This as the case of pediatric surgeon Professor Peter Beale is set for trial next week. Beale is accused of unlawfully and intentionally causing the death of a 3-year-old boy in March 2012, a 21-year-old girl in July 2016, and a 10-year-old boy in October 2019, following operations on their respective children. For more perspective on this, let's bring in Dr. Akhtar Hussain, who is the director at the South African Medical Association. Dr. Hussain, thank you for your time this evening. What implications do you think this case, if successful, will have on medical practitioners?
Thank you very much for having me, Channel 405 Newsroom. Let me start with saying South African Medical Association deeply empathize with those who have lost a loved one while undergoing a medical procedure and the surgery. So while there are certain inherent risks when undergoing a procedure or any surgery, unavoidably medical errors and adverse events may occur. SAMA is deeply concerned about the criminal charges, prosecuting and convicting of a doctor when medical errors occur, as this is an inappropriate response that would do little to prevent future tragedies. Charging a doctor with a murder in case of medical error is unjustifiable, extreme, and the growing trend may deter doctors from the performing certain risky operation, and consequence is diminishing access to a very highly specialized care.
So why do we draw the line?
No ethical doctor enter in an operating theater to do an operation with the intention of harming a patient. We also get devastated if things go not according to the plan.
So where do we draw the line, doctor? Because as much as there must be an appreciation of genuine medical errors, because things do go wrong in medicine. There may very well be cases of gross negligence in some instances, adverse events that could have been avoided. So how do you hold those doctors accountable?
You are right, because Health Professional Council of South Africa usually handle all this complaint and competency and continuous educational program and updating doctors' knowledge and skills. So we are there to save the patient. We are not save the patient life and make sure patient health and well-being maintained. By doing criminal justice system on a regular basis, whole health system factors need to be reviewed. That may be contribute in the loss of the patient's care.
How does the law as it currently stands hamper patients' safety and I suppose the achievement of a safety culture?
Safety culture depend multiple factors, Those are the specialized unit. They do those operation and make sure the outcome come 100% better. But in some cases, we do explain the patient's outcome. For example, if we are treating a cancer patient, and we know every cancer patient life expectancy, complication of treatment can be cause harm. So we make sure we do our best.
Are there organizational factors that need to be considered by the criminal justice system? What reforms do you think are necessary?
Yes, the reform is needed in a health system for criminal justice system urgently to review, and medical also require serious attention and intervention, as well the root cause to be analysis.
So government has a regulated set of care standards, from clinical standards to the working environment, the infrastructure, the human resources and technology. But have those helped in ensuring better and safer patient experiences and clinical outcomes?
Definitely, we follow all these safety standard and protocol and guidelines, which is highly standardized nationally and international level, so not to have any mishap happen. But if the cases are complicated and the outcome depend on the how complicated is the cases, and make sure we discuss with the patient before any operation we perform. We explain each and every point. There are some patient output and recovery rate is very, very good. Some patient get delayed, some patient get complicated. So we cannot say every operation, even you take a Panadol, it also got a side effect. It's also got a poor damaging can happen.
Yeah. Well, Dr. Akhtar Hussain, thank you so much for making time for us.